When you need emergency drug, you can lean on them. L for lidocaine, E for epinephrine, A for atropine sulfate, and N for Narcan. 6 essential mnemonics for acing the NCLEX exam on your first try. Retaining information for the Next Generation NCLEX can be daunting, but one way to help retain what you study is through nursing mnemonics. In this video, we will dive into 6 popular nursing mnemonics along with my rationales and explanations that will help you remember important information for your exam. Even experienced nurses can reference these mnemonics to handle challenging situations with their patients. The first nursing mnemonics are signs and symptoms of hypokalemia. If there's an L in hypokalemia, there's going to be L's everywhere. Run for it. L for lethargy, leg cramps, less pooping, think constipation. Limp muscle, if patient is cramping, you can associate that with the limp muscle. Less respiration, shallow respiration, respiratory count below average, and lethargy are cardiac symptoms such as arrhythmia. An example of watching out for hypokalemia is when a patient has metabolic acidosis. When you think of metabolic acidosis, you think of changes in the potassium level because potassium is an intracellular cation. You also think of hyperkalemia when you have metabolic acidosis, by the way. Cardiac symptoms to watch out for includes depressed U waves on the ECG. It is depressing if you get arrhythmia due to hypokalemia. If administering potassium, it is essential to check renal function first because the kidneys plays a primary role in regulating potassium. To help you remember, just think of the kidney shaped like a potato. Okay, so we have potassium, potato, kidney. So that should help you remember. The second nursing mnemonic is tuberculosis treatment. R for rifampin, I, isoniazid, INH, P for pyrazinamide, PCA, and E for ethambutol, also known as myambutol. And don't mind me, I probably pronounced some of these wrong, but that's okay. If tuberculosis is ripe, then you give ripe medication. Several medications can be prescribed at one time, which led to a reduced treatment time from 2 years to 6 months. After 3 negative sputum samples have been obtained, the patient is no longer considered contagious. PPD testing, also known as the Mantoux skin test, is read in 48 to 72 hours. A positive result does not automatically mean the patient has tuberculosis. It only means the patient has been exposed, confirmed with a chest x-ray. The third nursing mnemonic is Nonstress test. N for non-reactive, N for Nonstress, and N for not good. 3 negatives in a row to read the results of a Nonstress test. Nonstress test monitors the fetal response to the cycles of rest and activity. The mother presses the button every time she feels the baby moves inside her. A reactive Nonstress test. You want the fetus to react to the test. You're looking for 2 or more fetal heart rate accelerations of 15 beats per minute or more that last at least 15 seconds from the beginning to the end of the acceleration during a period of 20 minutes. A non-reactive Nonstress test. If the fetus is non-reactive, this is not good. We just went over the first 3 nursing mnemonics out of 100 nursing mnemonics that I created. If you want to download a sample for free, be sure to go to qdnurses.com to join my email list, and I'll send you 160 free digital flashcards. Don't forget to hit that red subscribe button below. The fourth nursing mnemonic is bleeding precautions. R for razor electric blades, A for aspirin, N for no needles, D for decrease in needle sticking if needle sticks is necessary, and I for injury that you want to prevent. And the mnemonic is Randy. Randy is on bleeding precaution because he's so clumsy. Why must you be so clumsy, Randy? It is important for the patient to avoid sharp objects that can cause bleeding, such as razor electric blades or needles. Aspirin can cause an increase in bleeding. And no one wants to have more than necessary amount of sticks or to intentionally get injured. The fifth nursing mnemonic are emergency drugs. L for lidocaine, E for epinephrine, A for atropine sulfate, and N for Narcan. When you need emergency drugs, you can lean on them. Lidocaine treats irregular heartbeats and relieves the pain by numbing the skin. Patient can use numbing lidocaine cream to decrease the pain of needle insertion. Epinephrine treats life-threatening allergic reactions by relaxing the airway muscles and tightening the blood vessels. It increases cardiac output. Atropine sulfate is used to treat bradycardia. Narcan is used for narcotic overdose, including respiratory depression. And the final nursing mnemonic is the sixth one, lidocaine toxicity. S is for slurred speech. A is for altered central nervous system. M is for muscle twitching. And S is for seizures. Sam's needs to stop taking lidocaine. It's not good for him. Lidocaine treats irregular heartbeat and relieves the pain by numbing the skin. Patient can use numbing lidocaine cream to decrease the pain of needle insertion. Too much lidocaine in the system can cause slurred speech, muscle twitching, seizures, and an altered central nervous system. Other symptoms include dizziness, visual disturbances, and audio disturbances, tinnitus, which is ringing in the ears. The first step is to stop the injection immediately and prepare to treat the toxicity. The priority is to stabilize the airway, the heart rate, and seizure. The therapeutic drug range for lidocaine is 1.5 to 5 microgram per milliliter. Lidocaine toxicity at levels greater than 5 microgram per milliliter. Nursing mnemonics are so helpful when it comes to reviewing for the Next Generation NCLEX. If you haven't already, you can check out my top 100 nursing mnemonics for the NCLEX at qdnurses.com, which will help you prepare for your exam. If you're not already subscribed, click the red button below.